Welcome back inside the Now Morning Show, ladies and gentlemen. Recently, the UK lifted the travel advisory against Trinidad and Tobago, and this morning we're going to be chatting with one of the most active Twitter users that I follow. I'm talking about Her Excellency Harriet Cross, the British High Commissioner to Trinidad and Tobago. Good morning to you.
Good morning. It's a real pleasure to be here. Thanks for having me.
Not a problem. So, tell us, well, I know that there are actively 1.3 million cases right now of the coronavirus, the COVID-19, in the UK. But is there any update? Has the numbers been decreasing or going up? What's happening in terms of a daily basis?
Over the last 7-day period, the numbers have gone up about 7%. So the numbers are rising a little bit. What's really interesting is that the hospitalisation and the death rates have not changed at all, even though the COVID infection rate has gone up. And that's sort of testimony to the effectiveness of the vaccine regime in the UK. We've got about 85% of the population vaccinated now, which means even though people are getting COVID, they're not getting ill or hospitalised with COVID. So that's really good news.
Are vaccinations mandatory in the UK?
No, they're not mandatory. In fact, there's actually a law to say that you cannot mandate vaccines to the general population.
Okay.
But what's quite interesting is the government is looking at whether they might make it mandatory for health and care workers, because they're working with some of the most vulnerable populations. So you may see that coming in the coming weeks and months, but it's not law yet.
All right, so let's talk about travelling to the UK now. In terms of the vaccines, which brands are acceptable by the UK when you're travelling in?
So at the moment, the UK has verified Pfizer, AstraZeneca, J&J and Moderna. Now, those are the 4 that are currently on the list. Now, we are looking to add other vaccines to that, but that's a longer process, and that's something that's happening now, but has not yet been approved. Now, in addition to having those 4 vaccines approved, we are also needing to approve each individual country's vaccination regime so that we can be sure that it's robust enough to fulfill our minimum standards. And those are actually online. If anybody wants to check what are those minimum standards for the vaccination regime, we've made those very public and transparent, so you can get hold of those if you want to.
Tell me why the process is longer to get additional vaccines on the list.
I think there may well be additional vaccines on the list, but I can't give you a timescale for that.
Okay. So what happens to the good folks of TNT who may have taken the Sinopharm vaccine? When they get to the UK, would they have to be quarantined, or what's the process?
So at the moment, Trinidad and Tobago's entire vaccine regime hasn't yet been approved. And I expect that to happen probably in the next couple of weeks or so, I hope. But at the moment, regardless of what vaccine you've got in Trinidad and Tobago, if you come to the UK, you will need to quarantine and take some PCR tests. So that's regardless of the vaccine you've taken at the moment. So you need to do a PCR test on arrival and a PCR test on day 2 and day 8. Your arrival in the UK. And within that regime, you need to do either 10 days quarantine, or you can choose to take an additional PCR test, and then you can be released after 5 days. So that applies to everybody at the moment. Now, the difference is that once we approve Trinidad and Tobago's vaccination regime, which, as I say, I think will be fairly soon, anybody who's had the 4 vaccines that I mentioned earlier won't need to take a test on arrival, and they won't need to quarantine. They'll just have to do a single test on day 2.
Interesting. Natalie?
Good morning to you, Ms. Cross. This is Natalie Legore here speaking with you.
So, good morning.
I am just curious as to what is the process that got vaccines like Pfizer, AstraZeneca, Moderna, and the Johnson & Johnson approved as compared to a Sputnik V or a Sinopharm?
There's a really quite a complex list of that you can work through to see how that decision making works. It's partly to do with efficacy. It's partly to do with where the vaccine has been manufactured. At the moment, I should say the 4 vaccines that are approved, they've been approved wherever they have been manufactured. So, sometimes you could get AstraZeneca that's been manufactured in Sweden or India, and we've verified all those manufacturing sites. And that's something that hasn't yet happened for the vaccines that are not yet on that list. But it's a work in progress.
Okay. Right. So I think Rawkus had asked, is it that if we come to the UK now with a Sinopharm vaccine, we have to quarantine?
Yeah.
Yes.
Just want to, how long is that quarantine process? I'm sorry, I didn't hear.
That's all right. You would need to quarantine for 10 days, or you can choose to have an additional PCR test, and then you can be, it's called test and release, and you can leave after 5 days once you get your PCR test results. The significant difference with the new regime is that until yesterday, anybody coming to the UK from Trinidad and Tobago had to quarantine in a hotel for 11 days, and that was an expensive endeavour. And now that hotel quarantine is entirely gone for anybody from TNT, again, regardless of what vaccine that they have got. And once the vaccine regime has been approved here, there'll be no quarantine at all for anybody who's had an approved vaccine currently on the list.
Ms. Cross, tell me about life on the ground in the UK. Do people still have to wear masks? Is it mandatory?
You know what? It's a bit of a mixed picture. In England, wearing of masks is not mandatory. It's encouraged in crowded places or public transport. However, businesses and transport companies are allowed to make their own mandates. So, for example, if you're travelling on London Underground, the Mayor of London has said, you need to wear a mask. And of course, the situation is a little bit different in Scotland, Wales and Northern Ireland, because they've got through the devolved system of government that we have, they can make their own laws. So masks are mandatory in some parts of the UK. For example, if you're going to a shop in Scotland, you will need to wear a mask.
Ah, okay.
And have you all implemented safe zones, as we're seeing Trinidad and Tobago roll out this morning, where if you're vaccinated, you can go in certain areas and enjoy whatever services are there?
You know what, we've experimented a little bit with it in terms of kind of pop concerts and clubbing and that sort of thing. There were a number of events that happened where we said, if you come vaccinated and with a PCR test, you can come to this concert. And it was almost a bit of a test to see then what the COVID rates were after that particular event had happened. But those have been sort of one-off events. There's actually there's no distinction if you want to go into a shop or a bar or a restaurant. You don't have to show that you're vaccinated. Having said that, one of the reasons we can do that is because the vast majority of the population are vaccinated. Right. So, 85% of the people going into that bar, we know necessarily will be vaccinated because of the rate across the population.
Ms. Cross, did it work? Did the experiment work, the test? Was there a rise in cases after the concerts?
I think it was a bit of a mixed picture, actually. I was just listening today to the news, and there was a suggestion that COVID rates had spiked in some areas as a result of these events. But again, the government is sort of risk managing those COVID spikes because there wasn't any subsequent hospitalisation or death rate along with it. So people felt sick and not very well, but it was a manageable result in some cases. If you want to go out to events and there's a high rate of vaccination, we'll put up with the fact that some people may get COVID as a result. Yeah. And for example, my mum and dad were both vaccinated and they got COVID. And that's a good example of, being vaccinated doesn't stop you getting COVID. But 2 80-year-old people, if they hadn't been vaccinated, I would have been really worried about them. Right. As it was, they had 2 weeks of not feeling very well, and then now they're back to normal. Okay. So vaccinations are working in the UK.
Great. I'm happy to hear that. I want to thank you so much for joining us this morning, and do have a fantastic day. Her Excellency Harriet Cross, the British High Commissioner to Trinidad and Tobago.
Absolute pleasure. Really nice talking to you both. Thank you.
Take care.
You're